Hi, my name is Paige Hawkins, and today I will be talking about TENS versus opioids for managing post-operative pain. Transcutaneous electrical nerve stimulation, known as TENS, can treat pain with less side effects when compared to or as opioids. So, as we know, opioids are endogenous, so it creates the feeling in your brain and it models dopamine. Um, the, and these medications can affect the body's natural pain management system by disrupting its function. So this is where we get these terrible side effects such as like nausea, vomiting, constipation, sedation, respiratory depression, and addiction. And people start to abuse them, and we definitely see this on the front lines because we deal with patients who have musculoskeletal pain and stuff like that. And it can also be very expensive for our patients as well. Then we have TENS units, which is they don't allow the pain to be sent up, so it stops at the spinal cord. The A beta fibers say, nope, you're not getting through, so it inhibits the input. It's fairly cheap, it's user friendly, we can send it home with our patient, it's non-invasive, there's no risk for addiction here. But we do need to keep in mind with both of these treatment that they are treating pain, but they are not solving the underlying problem. So you still have that there. It's just telling our body or our brains that there is no pain. So, how this relates to physical therapy. So, we work a lot with pain management, and our clients come in, and one of their chief complaints is pain. So, we need to address that and decrease their pain levels. So, surgery especially causes a lot of damage to the system, and it can be nociceptive or neuropathic, and as well, like, it's easy to develop a chronic pain from, this one incident or surgery. Um, it's reported that 85% of patients have post-surgical pain, and 75% of these patients describe the pain being moderate to extreme during the right after the post-operation period. So that's really important for us to realize that our patients are having pain, and we need to do whatever we can to lessen their pain to make them more comfortable. This is where TENS comes in. It could reduce pain and help. If it reduces pain, then there will not be that need for the medication of opioids and consumption. So after that, we would be lessening the chance of addiction if we use TENS, whereas opioids, then we get into all those side effects that we discussed earlier. And again, it's been proven that managing our patient's pain is associated with decreased healthcare costs, shorter time in the hospital, shorter time in therapy. They get up, they walk faster, they start moving, and overall, it increases the patient satisfaction. So, we are patient-centered care, and we want to do what's best for the patient and try to get them back doing what they need to do in their daily lives. And it's also been shown that using TENS in an early post-operative care has also been shown to reduce respiratory problems, hypoxia, and pressure sores, so that when you get them up and moving faster, you also decrease the chance of secondary issues that they might develop because they become inactive. Now, as I said before, TENS is a great opportunity and modality that we can use to help decrease the postoperative pain. So this would be like the protocol on how to do it. So this is different. Electrodes can be placed on the skin around the surgical site itself. Though you do need to check for sensation around the suture, because if they don't have sensation, well, that gets into a whole nother issue, a problem. So it needs to be close to the suture, but still check that they have sensation around the suture. Just a guideline, you should place it around 5 centimeters on either side of the suture. It's also important to note that the black electrode is active, so we want this as close as possible to the nerve we want to target or the area that needs to be treated. And like you guys know, if the placement isn't tolerated well, we can mix it up and the electrode can be positioned along the peripheral nerve proximal to the pain. It can be put into acupuncture or trigger points or dermatomes. And just remember to have some patience with the placement, and it might take a few trials and errors to get that perfect placement. It's been shown that it is important to use the highest intensity that a patient will tolerate. This really taps into the nerves and that noxious stimuli that we need to create for our patient to receive the painless effects. Also, it's been shown that increasing the amplitude for TENS on the TENS units allows it to reach much deeper into the tissue, therefore allowing for greater pain relief. It's also just a great reminder to remember those contraindications and precautions like altered sensation, cardiac pacemakers, tumors, pregnancies, damaged skins, and like not to do it over the carotid arteries or any place like that. And everyone's different. Everyone's going to have different levels of, intensity they might need. They might even not even like the stem or TENS unit or the electricity going into them. So then that's when you would have to go to another treatment. Patient education is super important with the TENS unit, especially if someone just came out of surgery, and they had to go under anesthesia. You might even want to communicate this with their family member or caretaker so that they understand how to use this machine so that the patient can get the best benefits. So it is important to tell them that they need to change the placement under the electrode, so they do not need to be placing the electrode on the same spot of the skin every time, because this will cause skin dryness or irritation. And this is a very important part, that you must increase intensity or the patient will start to develop a tolerance to TENS machine. And this is actually backed by science. They did a study and showed that over 8 weeks, the patients actually started to see a tolerance. So again, you need to keep pushing up that intensity so that they will get the best benefit from this treatment. Again, use teach back, make sure they understand, and follow up with the patient in a week and being like, is this really controlling your pain? How do you feel? You feel comfortable with it, so that we can make sure that their pain is being controlled. And if it's not, then look for another treatment or talk to their physician and create a new plan for them. So, thank you.